About 3 months ago, I had open heart surgery to save my life. For those that know me and have seen some of my earlier videos, I work in the creative technology field of marketing and advertising, and I'd used artificial intelligence to help me, make sense of this clinical experience, and it helped me considerably.
Remind patients that now they can actually talk to an intelligent system and get much more tailored recommendations for how they can manage their healthcare. Move away from the one-size-fits-all treatment journey into, well, what does this treatment truly mean for me and who I am and what I do and where I live and what I have access to? And all of a sudden it's like, wow, these are incredible recommendations that only a machine, I think, could deliver compared to what a physician might do.
Everything from how to decipher and understand the intricacies of the diagnoses, all the options available to me. My young children, my girl's a Swiftie, so I used a lot of the clinical narrative that described my condition and what I had to have happen to create Taylor Swift trivia and song-inspired lyrics that make sense of all of this so she can understand it, which was pretty incredible. My boy learned about what's going on with Daddy's heart by me taking that clinical narrative, asking it to translate it to basic basketball mechanics to explain the story. And he took that and he understood that. So that helped tremendously. I didn't stop there for me. After the surgery, which was a pretty traumatic experience, I had quite a few post-op complications. I realized that I could use AI also to make sense of all the test results coming through, all the medicines I was on. And when we were discharged, we were at the airport about to fly back home. I got a call about to board the plane. I get a call, it was the hospital. They said they want us to come back because more doctors have looked at the most recent scans and they're concerned with a problem. So we get back to the hospital and they tell us that I need open heart surgery again, this is 2 weeks later, to fix a problem that grew into something significant. We couldn't believe it. We said, when? They said tomorrow. So our whole world fell apart. I mean, can you imagine being hit with that? You just recovered and you need to go through this all over again. It was unbelievable. And so for me, I needed a coping mechanism. I needed a mindset focus. I needed a coach that could help me get through each of these stages all over again. So beyond the support of my wife, I was using AI as a daily coach to get through each and every situation. I had to be put to sleep and shocked back to a heart rhythm. I had to have 1.5 liters of fluid removed from my back through the ribs, 0.5 liter on the other side. I had several bouts of AFib. We went through everything. Every time we had a question or we had something we weren't getting significant answers from the care team, who were amazing, but we needed more. We wanted something more personal to me and my situation. We would turn to AI. We would take photos of my computers behind me, all the vitals, ask it questions, say, what does this heart rhythm, what does this heart beat and heart rate look like and mean for someone who's going through this, and this on this medication? It was an incredible lifeline. And it wasn't until going through the recovery of the second open heart surgery.
I remember walking in, being wheeled into the OR, and just this huge room with, white ceiling, white lights, blue lights, this wonderful orchestra of people and expertise and equipment.
That, I was asking myself, why did this happen to me? I was young and healthy with no heart symptoms whatsoever. And then it dawned on me that I was born to tell this story. I was born to put the specifics of a personalized health journey, something that I've experienced firsthand, with my understanding of artificial intelligence, to combine those in a purposeful way to, make sense and help guide me through it. And it helped tremendously. And I realized that I also need to help others that might be going through something similar, or anybody who has any clinical situation or any story or question about their health who wants a more customized, tailored care plan, more questions that are and answers that are provided that are more relative to their own personal circumstance. This can be done for free with the internet in a browser, and it can really help you make sense of it. I'll be sharing my story on stage next month at a pharma event, and also creating a lot more materials to share my story. We documented everything: photos, videos, voice recordings. I've been in touch with my surgeon. I'll be speaking with him in 2 weeks' time when I go for a 3-month follow-up visit. He's very interested in understanding how I've applied AI and how I'm looking to help other people, and also participate with other advocacy groups as a way to give back some of my time and share some of my expertise with others that are going through very difficult times. I'm looking to turn this life event and capitalize on the fact that I'm probably only one of a few, if not maybe the only technologist who's survived 2 open heart surgeries, a debridement, countless other procedures, and are born to tell a story of how technology can be used to help get through this type of situation or any type of clinical situation. The patient experience is evolving rapidly, and I'm convinced, after seeing it firsthand, that this will be the future of the patient experience. Thank you.